and thank you so much for joining us for today's webinar in our latest edition of the Compass Health Activation Webinar Series. My name is Alexandra, and today's webinar is entitled The Good, the Bad, and the Ugly of Accountability Plans. Today's webinar is presented by Compass co-founder and Chief Medical Officer, Dr. Eric Bricker. And with that, I will turn the floor over to Dr. Bricker.
Well, thank you so much, Alex, and welcome all of you. I'm so excited to have you on the webinar for today as part of our Compass Health Activation Webinar Series, The Good, Bad, and Ugly of Accountability Plan. And advance to the next slide. Here we go. So there's a picture of yours truly, the co-founder, Chief Medical Officer of Compass Professional Health Services. I'm a general internist, did my residency training at Johns Hopkins and the University of Illinois for medical school before that. I actually used to be a hospital finance consultant before going into medicine. So believe it or not, doctors and hospitals have a lot of trouble getting paid, so they hire outside consultants to come in and show them how to do that. And so I worked for one of the largest consulting firms in the country that did that and had a wealth of experience on the claim side, but wanted to be more clinically oriented, so went on to medical school and residency. And it was really sort of marrying that administrative or billing understanding of healthcare with the clinical side of healthcare that where I really, myself and my co-founders, really found that there was a need for companies and their employees for really sort of healthcare insiders or expertise to bring to their employees, especially with the sort of dawn of consumerism and consumer-directed health plans, where employees were asked to be, better stewards or consumers, and that's a very difficult thing to do. And so that was really the impetus or the genesis for Compass. Actually write a blog several days of the week, one honorable mention a couple of years, and we also have a healthcare price transparency group that has well over 2,000 members now. And the blog, you can either subscribe to the blog or you can actually get updates on the blog by becoming a member of that LinkedIn group as well. So Compass is tools and support for healthcare consumers. We have a health activation platform that provides concierge assistance for employees by phone or by email or through our member portal by giving folks in-network price transparency, and we also drive activation in wellness programs, one of the things that we're going to talk about today. And that combination of consumerism plus wellness has really resulted in not only decreased out-of-pocket costs for our members, but then decreased overall healthcare spend for the plans as well. We have over 2,000 employer clients. These are some of the larger national account sort of clients that we have. So some of these folks are actually on the call today. So we have a lot of our customers on the call today. A lot of our broker benefit customers are on the call today. We have some prospective customers that are on the call today. So really want to welcome all of you. Some of our existing clients, as you can see here, are Southwest Airlines, T-Mobile, Barry Wehmiller is just a fantastic manufacturing company that's based out of St. Louis, the Dillard's department store. If you have a garage door opener, it's probably a Genie, and that Genie is made by Overhead Door. Michael's Arts and Crafts Stores, Chili's Maggiano's Restaurants, Nebraska Furniture Mart, SMU Energy Future Holdings, Atmos Energy, Tyler Technology, which is software for municipalities, Sabre Holdings, which is software for a lot of the airline industry. So just wonderful clients, and really geographically, T-Mobile is based in the Seattle area, and we have municipality clients in Florida. So really spans the country, and just wonderful people and wonderful clients to have. So the good, the bad, and the ugly of accountability plans. Well, in order for us to talk about accountability plans, we have to first define sort of what they are. So this is having an employee, and potentially their family members, avoid a premium surcharge or receive a deposit into their HSA or HRA account contingent upon completion of certain activities. And so what we generally see is that those activities might be things like getting an annual physical, getting biometrics, maybe having a health risk, answering a health risk assessment. We also have employers go through our own sort of Compass registration process that we call Get Connected. We have some employers also say, okay, well, not only getting your annual physical and your biometrics and maybe your health risk assessment, but if you're over the age of 50 and you need to get a colonoscopy, then you need to get your colonoscopy. Or if you need to get your mammogram, or if you need to have any of your other age and gender appropriate screenings, then you also have to do those as well. So some combination of those, and we call that that prevention. So some sort of combination of those activities are required in order to either avoid the premium surcharge or to receive the deposit into the HSA or the HRA accounts. We call that an accountability plan. We oftentimes will see that employers will sort of phase in different requirements over time. So in year one, they might have these 4 requirements, but then in year 2, they might add, okay, well, getting your biometrics is great, but if you have elevated blood pressure and if you have elevated cholesterol, then you also then need to complete a metabolic syndrome program, or maybe an online course, or maybe telephonic coaching, so to actually do some type of sort of intervention based upon those biometrics. And then we have employers that are actually then doing outcomes-based as well, where it's not only that you received the counseling on the blood pressure or metabolic syndrome, but that you actually have achieved some goals in that area. So that's what we mean when we talk about accountability plans. Now, what is the landscape of accountability plans across employers? So, and this is according to various surveys. You can see the references there at the bottom. And 72% of employers with 5,000 or more employees offer some type of incentives for biometrics, health risk assessments, or other activities. So 5,000 employees plus the large employer. So we definitely see the presence of incentives in that size employer group. So another survey, I've just defined it as quote-unquote large employers, which for all the folks out there probably includes mid-market employers as well. It probably goes down into the several hundreds of employees that they define as large. They found that 60% of those in that survey offered incentives for the above wellness activities. Okay, and then at companies that offer wellness programs with incentives, 50% of the employees participated. So in other words, if you offer incentives, does everybody participate? Well, no. It's not a small minority, but about half the employees actually participate. So there's some benchmarking data for you. Employers offer an average of $880 per employee per year in the incentives. So when you're thinking about the dollar amount that your own company either does currently or might do in the future, then you can see what the national average is there of $880 per employee per year. And then employees only collect on average about $365 per employee per year in those incentives. So that kind of makes sense, right? If about, in point number 3, if about half the employees are actually participating, well then the actual sort of money that's up for grabs is a little less than half of the total as well. And 50% of large employers plan on moving to financial penalties in the next 3 to 5 years. So the whole concept of carrot versus stick, typically the carrot approach is either dollar deposits into the HSA or the HRA, sometimes actual money or gift cards, but typically it's the HSA or the HRA deposit. But the premium surcharge, so in other words, having to pay upwards of 30% more, let's say on a biweekly period, to have that come out of your paycheck if you don't do certain things. So that sort of premium surcharge or penalty if you don't do the activities, that, as you can see, is coming down the pipe over the next 3 to 5 years. So takeaways: most larger employers offer some type of wellness program. Most offer incentives in conjunction with those wellness programs. Employees don't take advantage of all those incentives, and many will be changing that incentive to a penalty, in effect, because they want greater activation or participation than the 50% that they're currently getting. So how does all this, of course, relate to the Affordable Care Act? We have to talk about the Affordable Care Act. So it allows for up to 30% of employee-only health plan costs to be tied to wellness incentives. So the ACA absolutely allows for wellness incentives, and then an additional up to 50%. So in other words, the wellness incentives plus tobacco, if there is a tobacco cessation requirement or program as part of the health plan. Now, there was a conflict between the Equal Employment Opportunity Commission, or the EEOC, in regards to not discriminating against employees or not having employees share health information with their employers, but they recently clarified a conflict between the above ACA regulations and the Americans with Disabilities Act regulations, which said that employers could not require or penalize those who did not participate in health screenings, right? So there was that Honeywell lawsuit that some of you may have been aware of, and so they essentially came out with guidance to reconcile the ACA with the EEOC regulations, and in effect, the EEOC agreed with the ACA incentive policy. So, and that was only in April of 2015. So, really, only within the past 10 months that employers have received some degree of clarity around the regulations. So, now in regards to best practices, in order to receive an incentive or avoid a penalty, does it make sense to bundle all activities into a pass-fail grade? In other words, you do everything you pass, you only do 2 out of the 3 activities you fail, or should employees be allowed to earn certain dollar amounts for various individual activities? Great question. And we've seen across our employer base a variety of approaches. So the Activity Bundle Pro is that there are higher levels of participation in all activities possible. We've seen up to 80% of the employees, let's say you have 3 things that you need them to do, health risk assessment, biometrics, and annual physical, then we've seen groups get as high as 80%. And as you imagine, as you get more people involved in the program, then we've seen that associated with either a 3% trend or as low as a negative 15% trend. And then the Activity Bundle Con, it may just be too hard for employers to effectively communicate, or the employee may find the bundle requirements just too onerous. And so there, for companies where the communication has been poor or the employees just are not able to wrap their head around doing these 3 activities, then we've seen participation be as low as 26%. Now, the Individual Incentives Pro, so breaking everything up, let's say you were going to give, let's say, $600 in incentives, and you had 3 things you needed them to do, and you wanted to do $200 for thing 1, $200 for thing 2, and $200 for thing 3. In other words, breaking them up allows the employees to earn the incentives they want for the types of activities they want to do. In other words, the employee just might only feel comfortable with only 1 out of the 3. Well, at least they get something for that when it is an individual incentive. Now, the Individual Incentive Con is that it tends to be less impactful in terms of total participation in all activities. As you can imagine, if you give people an option of doing 1, 2, or 3 things, and you'll give them money sort of each step of the way, then people will self-segregate into, well, some folks will only do 1, some folks will do 2, and some folks will do 3. So it's more realistic to expect people to do a various combination of the 3 tasks, as opposed to thinking, oh, well, everybody will do all 3. They probably won't. And so the takeaway is employers must balance the of behavior modification with the gain of improved health plan performance. As you can imagine, as you can improve the behavior in terms of prevention and being better healthcare consumers, then your plan performance is going to be better. And if only, let's say, a small percentage of the population actually makes that behavior change, well, then it's just going to be less impactful on claims. Now, best practice around dollar amounts. So as this is actually Compass data in terms of, on the x-axis you have the annual dollar amount of what the incentive would be, and then you have on the y-axis the percentage of participation. And as you can imagine, there's a positive correlation, right? If you incent with more money, you tend to get more participation. But there is diminishing returns, right? So as you can see that we've never seen 100%, and this kind of goes along with your employee within any population, whether it's your company or any company. There's going to be a segment of employees that are early adopters. This tends to be about 17% of the population. Then the vast majority in the middle, the 66%, tend to be what are called pragmatistic conservatives. And then there are always about 17%, or 1 standard deviation, that are skeptics. And for skeptics, for whatever reason, they are likely, sort of regardless of how much money you give them, they are likely to not participate just because they're skeptical. So in terms of managing expectations, then we found that, look, if you get up to about $700, there really is about, it's really where it starts to flatten off in terms of the diminishing returns in regards to participation vis-a-vis the amount of money you give them. And then based on our previous experience, we've also seen that, as you can imagine, you get the biggest bang for your buck getting up to $500. And so really we've seen about $500 to $750 per employee per year. And that can be either, given as the lump sum into the HSA or the HRA account, or it can be split up among the 26 pay periods, or however you pay out the employees in terms of a premium surcharge that could be avoided. So now, of course, you have to track all this. And you have to track all this, of course, at the employee level so that they can know, okay, well, what do I need to do and kind of where do I stand in regards to that? So we do that tracking through our Compass Member Portal. You might have a separate platform that you use. We actually have some employers that try to do this all by hand on Excel spreadsheets. I will tell you right now, that is not the way to go. But in regards to our member portal, what's great is that it allows folks to actually connect with their health pro, find a doctor, look up costs in addition to doing the incentive tracking. And it's it's responsive web design, which basically means it looks like an app when it's on your tablet or your phone, but then you can obviously also use it on your laptop or desktop. When folks first use our member portal, they have to do a registration process that we call Get Connected. And we use it, one, to educate folks around our service. So we actually have a short 90-second video that that's very engaging, that explains what we do. We then ask for information about the person so that we can link them up. We'll be getting a census feed from the employer or third-party eligibility provider, and then we'll link that up just so that every random Joe just can't log on to the portal. You have to be linked up in terms of our system. And then you can actually add other family members and other family members' email addresses as well. People can add a personal email address, or they can add a family member and a family member's email address as well. And we'll get to this in a minute with communication. And that's important because we communicate around how to be better healthcare consumers and how to achieve the incentive in the accountability plan. We communicate that on a monthly basis. And it's great to be able to send that to people's personal email if they have them and they use them. We'll talk about other communication routes as well. So we collect personal email, and then we have obviously you're all familiar with health risk assessment. We kind of call this a consumerism risk assessment, where we ask, okay, do you have a primary care physician? Are you currently taking any medications? Do you have any upcoming tests? Do you have any upcoming procedures? And then do you have any existing medical conditions? And all of this information is then routed to the health pro, who can then which we call our advocate concierge folks, which they can then either have that information on hand when the employee contacts us, so we can actually generate proactive information and solutions out to members, potentially around how they could fulfill their incentive requirements based upon how they've answered this consumerism risk assessment. And then we get their preferences in terms of location and even around the gender of the physician, around bedside manner, things of that sort, so that when we're finding providers for people, that they really are in line with the personality and the style and the experience that the person's looking for. And that's it. You're connected. Probably takes 5 minutes max to do all that. And then in terms of the incentive tracking, we actually will have on this exclamation mark here, that's where if you click on it, it'll list out, okay, well, what do you have to do? So one of the three, it might be health risk assessment, biometrics, and then having a primary care physician annual physical. And so you can see here's one of the 3 things you have to do, biometric screening. It has the due date, right? You always have to establish due dates for this. And then right through the portal, it gives you a way to accomplish this. So you can either log on to the site, in this case, to actually do some scheduling for it. Or what's great is that we also, on our platform, and I would say this is important when you're evaluating any platform, is to have an exception management process. So there might be, for a variety of reasons, why the person is unable to do biometrics at that time. Heaven forbid, maybe they're undergoing, they've got cancer and they're undergoing chemotherapy, and maybe just their blood counts would be completely thrown out of whack because of the chemo that they're getting. And so maybe that's just not the appropriate, which is completely fine. I mean, it's going to be the minority of employees that are going to have an exception process, but just to be able to handle that, of course, prevents the calls or literally walking into the door of HR in order to allow this to flow smoothly. Same thing for the annual physical. They might be in a situation where getting an annual physical might not be appropriate for them, and they can manage that through the portal as well. We really encourage employers to have annual physicals at primary care physicians as one of the requirements. There's been a variety of press. I actually did one of these webinars about annual physicals, and there are certain U.S. Preventive Services Task Force things that you need to accomplish as part of that annual physical, so it's good to go to that. It's also good just to establish care with a primary care physician. One of the challenges of the traditional sort of quote-unquote PPO network is people would self-refer to all the ologists. And there's over 62 different ologists out there, and people will self-refer to the wrong ologist. And so to be able to have the primary care physician, one, address a lot of the common conditions, high blood pressure, high cholesterol, symptoms like upper respiratory tract infections, urinary tract infections, whether it's eczema or maybe some other type of rash as well. That PCP can handle a lot of those issues without having to go see a specialist. And so it's essentially the way that the rest of the world accesses healthcare. Only in America do we self-refer to specialists. Everywhere else, go to primary care physicians. And guess what? Not only do they have better health outcomes, but they also end up costing less. So the PCP allows the care to be coordinated. If you do need to see a specialist, that's fine, but that way the care is actually quarterbacked or coordinated by that PCP, and then it ends up being much more cost-effective as well. As you can see, the annual healthcare expenditures for a person without a primary care physician is $3,100 versus somebody with a primary care physician is $2,000, according to this Health Affairs article. Okay, so obviously everyone is not going to be logging into their portal or their platform on a daily basis to see, well, where do I stand with my incentives? So we have to do push notifications as well, and we call those health tracks. We send those out by secure email, and so you can see an example here where this particular person has, as of 1/26/15, they've got 2 actions remaining. So they've got their preventive physical exam due on September 30th. So we'll actually integrate with, we're sort of health risk assessment and biometric vendor agnostic. We'll work with anybody. It's typically at the employers and the broker benefits consultant's behest, but we'll actually be able to do file feeds and integrate, in this case, with Vitality. So achieving Vitality Gold status, if you achieve that Vitality Gold status, it's sent by Vitality over to us, and so we'll be able to track that on our portal as well. And then you can see here this person did complete their cervical cancer screening, which is attached here. And all of those activities are then coordinated by the Compass Health Pro. And this is an actual Compass Health Pro. This is not a stock photo. And again, the employees interact by phone or email, or they can actually message them through the portal as well. So it's like, okay, they need a physical. Well, what doctor should I go to? And that's where the Compass folks will find people that have the appointment availability and the location. They will have sort of a bedside manner. We also do a lot of analysis of those primary care physicians in terms of their training and their expertise and their quality as well. So it's great to, it's important to have the call to action or what the employee needs to do, just to make it as simple as possible. If the employee themselves has to be like, okay, I got to find the gastroenterologist, get a colonoscopy, and then I got to find my primary care physician, and just to have somebody else just do that for them, actually we found increases the compliance rates, right? Because not only is the money going to help, but just making it easy is also going to help as well. And what's great is we've really found a lot of synergy between our healthcare consumerism support and the accountability program, because once they start interacting with the Health Pro, we can then guide them around, okay, well, how do your benefits cover not only preventive services, but then if you do end up having to have, bunion surgery, okay, well, how is your bunion surgery actually covered? And then finding great physicians, like we already talked about, giving the in-network price transparency and quality information. We also integrate with supporting their prescriptions as well, so helping to find lower-cost generics or lower-cost ways to fill their prescriptions, whether it be by mail order, helping them, holding their hand through step therapy if you have step therapy requirements. And then lastly, of course, if you're going to get health care, you almost always get a bill. And so we can always review those bills, and if we find an error, work to resolve that error on the employee's behalf. And so the connection between the accountability program and the consumerism is really great. And that's where, now this is for an upper endoscopy in St. Louis. So this is not a preventative test. It might be done for like heartburn or trouble swallowing by a gastroenterologist. But this is where within your existing carrier network, look at this, the allowed amount or the contracted rate at Mercy Hospital is $2,378. At St. Mary's, it's $1,473. And at an independent endoscopy center, it's $429. I mean, these are all in network, and these are all the allowed amounts. And so certainly not in all cases, but in some cases, the same gastroenterologist will be like, okay, well, I scope at Mercy on Monday and then at the endoscopy center on Tuesday. So even if you like your physician and you don't want to change, you certainly want to be aware of what your cost options are and what the cost is going to be in advance. And typically, places like independent imaging centers and endoscopy centers, they just don't have the contracting clout that a major hospital has. So it might be an incredibly high quality facility, very clean, but just because they don't have the contracting clout, then they can't negotiate as high of an allowed amount as a hospital system could. And so it's not, I mean, we've got, several other webinars where we talked about the cost-quality disconnect, but it's important for people, especially when they're on a CDHP or a high-deductible health plan, to be aware of what those costs are, because the employee themselves, whether it be in the deductible or the co-insurance, they're going to be bearing a lot of those costs. So what are some mistakes to avoid? One, under-communicating. So obviously, all the activities that need to be done, and then the incentive or penalty that is out there need to be communicated in the initial rollout, which oftentimes is in conjunction with open enrollment, but it might be separate from that. Then again, monthly communication in addition to the health track. So not only are we sending people their health tracks either monthly or quarterly, but also those monthly consumerism tips on a monthly basis as well. Having management champions, we find that for a lot of blue-collar manufacturing employers that they don't use email and they're not on computers. That's totally fine. But we've had very high participation rates, whether it's used through like a monthly safety meeting, but there has to be some type of structure or platform in place through the management for communicating that out. If you have to build that from scratch, and it's not impossible, but it's hard to do. And so leveraging those existing meeting structures is very important. Using video, having executive messaging. We've even had the CEOs of companies make a video, and it's been incredibly impactful and successful. Timeframes that are too short. Some groups have said, well, I want to get this all accomplished in 3 months. Well, it's better to give them at least 6 and preferably 9. So most groups have a plan year that's 1-1, and their open enrollment, let's say, is in October. Then typically what they'll do is they'll give them until the end of September to complete all of their tasks, and they'll know, okay, well, did I or did I not? And then the dollar amount of the incentive or the premium differential is then assessed typically for the subsequent plan year, and that way when they're going through open enrollment, they can say, okay, well, I didn't do all of my activities, so I'm going to get my 30% premium surcharge, and then as I'm looking at my different plan options and what my premium would be, I know that it's going to be the premium plus 30% given the fact that I didn't accomplish everything that I needed to be accomplished. Under-resourced during implementation. So obviously it needs to be a priority of HR and the benefit consultant and broker, along with whatever vendor you choose. It's really a team effort. We have a very structured implementation plan that we go through, and the HR person might be new, and there might be too many compliance-related priorities related to ACA. That's completely fine and understandable, but if HR and the broker benefit consultant want to make this a priority, then it absolutely can be successful. And then that implementation timeframe needs to be at least 4 months. I would say that the limiting step typically has to do with the data feed, because obviously whether it's your IT department or some outside vendor, you have to work within their timeframe as well. And so typically if you can give them at least 4 months to work through setting up the file feed process, then it's able to be accomplished. Additional mistakes to avoid. Lack of support from the CEO and executives. I will tell you that in year 1 and year 2, there's probably going to be some noise around it, right? We talked about how 17% of employees are skeptics, and they might, for various reasons, some reasons rational, some reasons irrational, might not like the idea of this program, of the accountability program. But if there's buy-in culturally from the CEO or the executive team to say, look, this is a partnership between the employees and the plan. The plan takes care of the employees, but the employees need to take care of the plan as well. And in order to do that, then we need your partnership, and we need you to do something. If the CEOs and the executive team believe in that, then it'll work great. If there's not buy-in and it's just not a direction that they as an executive want to go in, then it's not going to work. So it's very important to have alignment. Just poor labor relations with employees. Obviously, I mean, we've seen companies where, and even if there are some skeptical people, it's not a lot because they have a very good relationship with their employer, not just in terms of benefits, but just in terms of work in general. And so some companies just have high turnover. So there I wouldn't say that they have bad labor relations. It's just that all the employees are new because they're constantly new, whether it's because they're in hospitality or retail, or sometimes nursing homes have a lot of turnover as well. And so that's just where essentially if you are educating, I mean, it applies to wellness programs as well. If you're educating people to be better healthcare consumers and making them healthier, and then they leave, well, then that's not going to essentially benefit the plan. And then if you're constantly having to re-educate new people every year because of the turnover, then just the participation tends to not be as high as well because of that high rate of turnover. And then also, And the accountability plan is not a silver bullet. We've had employers say, okay, I've got my $200 deductible plan, and I don't want to raise my deductible, and I don't want to have my healthcare costs go up. And I will tell you that a very rich plan design plus an accountability plan does not necessarily equal healthcare cost savings. Typically, it is done in conjunction with consumerism or a CDHP. It doesn't have to be just quote-unquote cost shifting. I mean, we have employers that maybe only have an $1,800 or $2,000 individual deductible, but they'll give them like, at least half of that in HSA or HRA dollars. So it can still, and that money can roll over from year to year, so you can still make it financially not extremely onerous, but that just the idea of the HSA or the HRA or the consumer plan, it's like it's not just some blank check, it's their money that they're going to keep, and that's part of the behavior change that goes along with the accountability plan. I want to go over our case study here. So this is a publicly traded national employer. They actually are an energy company, but they also, because they deal in the oil business, they actually have sort of a distribution channel of convenience stores that they run as well. And they have been using Compass since 2011. Many of their employees have weight issues, and less than 10% had a primary care physician to start back in 2011. But then they partnered with Compass, and in 2013, then they put in December, and they put in an accountability plan as essentially described earlier in the presentations to get their preventive screenings. And they found that their initial utilization prior to the accountability plan was 15% of the employees, and then after the accountability plan was put in, 53% of the employees participated. And you can see, and this is just medical, it's not pharmacy, too, that they were going at $845 PEPM, then through Compass helping folks be better healthcare consumers, their trend was going down, and then they added the accountability program, and it continued to go down even more. And over time, we had increased their annual physical exams from that initial 10% up to 29%, but then we increased it even more to 51%. And so just incredible participation. And I will say that there was really very minimal noise with this group. But I think the reason that it was successful was because they wanted to just make it as easy as possible for the employees. That's one. Two, they didn't have a ton of turnover. They actually had quite a few, a large percentage of longer-standing employees. And I would say that there was a culture of trust where the employees knew that the employer was looking out for them, and vice versa. So what are take-home lessons? One, accountability plan design leads to behavior change, which can lead to better health and lower costs. Two, this direction is being set by progressive employers, so your peers are moving in this direction. It complies with ACA and EEOC. Bundling activities and incenting with greater than $500 per employee per year tends to get the greatest degree of participation. To then make it, quote-unquote, as easy as possible, you want to enable that accountability plan with some type of concierge support or navigation, so people plus a technology platform for the tracking, and then, of course, communicate. And then to then tie in with consumerism, right? So you've got them engaged in their health. It's also to get them engaged with accessing the healthcare system. It's really a combination of the two. You want to make folks, you want to catch disease early, you want to make people as healthy as possible, and then you want to make sure that they're accessing the health system in a way that's not only to their own benefit, but is also to the benefit of the plan as well. And so that's where our tools and support for healthcare consumers at Compass, we really find that people, they just want to make healthcare easy first, right? Understand the benefits, find a doctor, get help with their medical bills, be involved in that accountability program. And then over time, that sort of mindset or the sophistication of the employee as a healthcare consumer improves. And that's where we then begin helping folks with comparative cost information and quality information for doctors and hospitals, and also with the prescription assistance as well. And that's where, again, we see that, hey, 61% of the time you start out with one of these, let's say, level 1 activities, then we see 61% of the time folks coming back to these more sophisticated level 2 type activities. And again, it's that Compass Health Pro that interacts with your benefits, and if you have any case management, dental, vision, wellness program, pharmacy benefits, HR, all of that is integrated as the essentially front line to the healthcare system for your employees is their Compass Health Pro. And so that is the conclusion. And so I am so thankful that all of you gave me your time and attention today. I'm incredibly appreciative of that. Somebody already messaged me beforehand that they wanted a copy of the slides. I'd be happy to email you the slides if you email me at ericb@compassphs.com. You can also, again, follow the blog on our website, compassphs.com/blog. If you're on Twitter, my Twitter handle is at Dr. Eric B. I have over 2,000 Twitter followers, and so it's great to connect with folks there as well. And then we have additional recorded previous webinars on our website as well under the Best Practices tab. And then in a little bit, this webinar will also be captured and posted on that Best Practices site on our website as well. So with that, I will conclude the webinar and have a fantastic rest of your day.